Welcome to The Explainer. Today, we're breaking down a really groundbreaking study that brings together AI, cloud computing, and some pretty advanced medical imaging. It's all about a system designed to fight one of the biggest problems in global health, preventable blindness. Millions of people lose their sight every year, not because their condition is untreatable, but simply because they can't get to a specialist in time. We're going to look at how a new AI platform could completely change that, acting like an expert eye in the cloud that's available to anyone, anywhere.
So let's just start with the big question, the one that's really driving all this research. And it's a bold one for sure, but it gets right to the heart of what's at stake. When we're talking about something as precious as our sight, the stakes couldn't be higher. This is a challenge that's not just about technology, it's deeply, deeply human.
All right, to really get why this innovation is such a big deal, we first need to understand the sheer scale of the problem it's trying to solve. Why is a tool like this so desperately needed right now?
Well, the core issue is this massive imbalance. On one hand, you have literally millions of people with retinal conditions that can lead to blindness if they're not caught early. But on the other hand, there's a severe shortage of ophthalmologists. Those are the highly trained specialists who can actually detect these diseases. In so many parts of the world, particularly rural areas, the nearest expert could be hours and hours away. That creates a really dangerous gap in care.
So, the big question is, how can technology possibly bridge a gap that wide? Let's dive into the specifics of the solution these researchers came up with.
What they created is a system called AI Paris, and you can think of it as this central intelligent hub for eye health. It's a platform built entirely in the cloud that uses artificial intelligence to analyze eye scans, and it doesn't matter where in the world those scans are taken.
Now, a really key piece of this puzzle is the type of data the AI is using. See, it's not just looking at flat 2D photos of an eye. Instead, it's analyzing these incredibly detailed 3D scans from a technology called optical coherence tomography, or OCT. And this is so important because OCT gives you a cross-sectional view. It's almost like taking a microscopic slice of the retina. That depth lets the AI spot subtle, early signs of disease that would be totally invisible in a regular photo.
And the whole process is just beautifully simple. A patient can go to a local clinic, maybe one that's never had an eye specialist on staff. They get a quick 3D scan, and that scan gets uploaded right to the cloud. From there, the AI goes to work, screening for 15 different conditions. Its findings are then zipped over to a human expert who could be anywhere in the world for a final confirmation. It's a system that brings the specialist to the patient virtually.
But here's the million-dollar question, right? How good is it really? An AI assistant is only helpful if it's accurate. So let's see how its performance actually stacks up against human experts. The results from the study pretty much speak for themselves. The AI platform had an accuracy of over 93%. To put that in perspective, that's right on par with the performance of experienced, specialized doctors. And when you actually visualize the numbers here, it's even more impressive. The AI model's accuracy, at just over 93%, actually edged out both the attending specialists and the resident doctors who were part of this study. So it's not just as good. In this particular test, it was even slightly better.
Let's dig even deeper into these numbers, because this is where it gets really interesting. While overall accuracy is great, you could argue that the false negative rate is the most critical number on this chart. A false negative is when a disease is there, but it gets missed. For a patient, that's the worst-case scenario. And look at this. The AI's false negative rate was nearly half that of the attending specialists. That is a massive improvement. It means far fewer people with real diseases are told they're fine and sent home without getting the treatment they need.
This incredible performance isn't just a lab experiment. I think the most impressive part of this whole story is that they didn't just build a cool AI model, they actually deployed it in the real world.
And when I say deployed, I mean they deployed it at a massive scale. The AI Porous system has been rolled out to 207 different medical institutions spread across 29 provinces. This isn't some small pilot study. This is a full-on nationwide implementation.
And through that huge network, the platform has already provided remote diagnoses for over 116,000 patients. And it's important to remember, each one of those numbers is a person who got access to specialist-level eye care that they almost certainly would not have had otherwise.
Now, making a rollout of this size happen meant they had to solve a really tricky technical problem called domain adaptation. Basically, different hospitals use different brands of OCT scanners, and these machines all produce slightly different-looking images. An AI trained only on scans from machine A would get totally confused by scans from machine B. So the researchers had to teach the AI to be a kind of universal translator, making sure it could read scans accurately no matter which machine they came from.
So let's pull all of this together. What does this mean for the big picture? What are the real long-term implications for the future of healthcare?
Well, the impact here is huge, and it works on a few different levels. First, it completely democratizes expertise, right? It just smashes the geographic barriers to care. Second, it helps reduce the incredible burden on specialists, freeing them up to focus on the toughest cases. Third, and this is a big one, by diagnosing all these patients, it's created this incredibly valuable data set that can help us spot public health trends. And finally, it serves as a powerful blueprint, a roadmap for how to take other medical AI systems out of the lab and get them into the real world, where they can actually help people.
So, at the end of the day, this is about so much more than just a single diagnostic tool. Technology like this really represents a fundamental shift towards a healthcare system that is more proactive, more accessible, and way more data-informed for everybody.
And that leaves us with one last, kind of provocative thought to chew on. People have always said the eye is a window to our overall health. So, as AI gives us a much clearer view through that window, you have to wonder, what other invisible health crises are technologies like this about to bring into focus?